afternoon, everyone. A case study on AI in the fight against COVID-19. This is my topic for today, which is based on incident 173. This is Rizana Gajurel. I am a data science student and I'm presenting for my data ethics and responsibility final. So the introduction is, as we all know that the COVID-19 started on 2019. This material is basically focused into the COVID-19, which has happened in March 2020 in Europe. They have faced several COVID-19 outbreaks. There were very healthcare systems that were in shortage of supplies, and because of the limited understanding, um, poor data quality, and all those artificial intelligence um, which were not working properly at that time. This is the COVID-19 transmissions. As we all know, the COVID-19 started in 2019 from Wuhan, China, and it spread all over the world. You can see in this diagram that how the COVID-19 is spread all over the world from December 2019 to March 2020, various countries, various places all over the world. The role of artificial intelligence in combating COVID-19. As you can see in this picture, how it is taking place when the COVID-19 was happening and how the process involved in AI that aided in the prevention for diagnosis, hospital management, etc. I took this picture because I really felt this is very useful to elaborate that how the AI tried to work on during a COVID-19 time to help the COVID-19 situations using the different data collections, merging into the clinical data processing happened using different AI technologies, AI algorithms, and how we try to prevent the disease, how we try to diagnose it, what are the hospital operations has taken, all the rules and all, and the medications applied based on the COVID-19 cases. How we use the screening during the COVID-19. As you can see here, and if you guys remember that during those times, wherever we used to go, not even in hospital, everywhere, we used to have the face scans, temperature scans, how the fever is going on and everything. Also, there were wearable technology came into screen for resting, heart rate, how it is going, and the screening and diagnosis through the chatbot as well took in place as an AI implementation during a COVID-19. What went wrong? So definitely there were so many things went wrong during a COVID-19. That's what we were not able to um, not able to make a solutions, find solution kind of things to stop or control the COVID-19 cases. It were spreading and spreading and became a big pandemic all over the world. The roadblocks were like AI development calls in the AI tool constructions itself. Data quality was not sufficient. Also, like more majorly into the how we collected the data during that time, like the unreliable sources. Those were the problems generated, as well as the inflating accuracies, combining multiple sources, combine the data sets that of secure true data origin, and like the hospital text font data introduces biases, automated automation biases, and all these kind of things happen when we collected the data and tried to work on whatever recent data we had at that time. The violation of the data ethics and responsibility during that time, I feel like. We were depending into the poor data quality, which was not a reliable source we taken from, which were like inaccurate data, biased data for training AI system, which were like unreliable predictions and the decisions made because of those for the quality and the integrity of the data. Also, like automated bias happened in the AI algorithms, trained on the bias data, the decision making, the healthcare management, and all those kind of things happened because of the automated bias. The human oversight is when the data collections happens, the errors in data collections, like the labeling, how we processing the data, and allowing the data into mistakes during COVID-19 cases. Those were like more into um, AI-driven predictions and decisions issues. The other one is complex global landscape. We were like the challenges the data is still sharing the health data across the border, the couple the violence in data governance, policies and ethical frameworks, and all those kind of things happen, which were very, um, kind of backward. We faced in AI tools for pandemic management. Potential harm was definitely it was a potential harm when the AI tools like there were a significant concern about like how the inaccurate AI tools impact in clinical settings, the predictions of the inappropriate treatment for patient harm, different like deployment was made without the validation increases, or the risk of unreliable tools, like all this kind of transparency and accountability concerns and the lack of challenging posing risk of patients, trust in the healthcare system, like those kind of potential harms was happen because of the AI has faced a lot of issues to control the COVID-19. What could have been done better during that time? Like I would say, the enhance the data quality and the variability for training AI models. We do have, we should have continuously refined AI algorithms for various detections, diagnosis, and contract training, foster interdisciplinary collaboration between the AI researchers, and the healthcare professionals would be there, address ethical concerns such as data privacy and algorithmic bias, as well as implement the rigorous validation and evaluation protocols for AI tools. The streamlined deployment and the integration of AI solutions into healthcare system also would be done with, and then provide educations and awareness about the AI's capabilities and limitations in COVID-19 control should be done better at that time. The recommended solution, I would say, like we were not in the beginning or the middle of the phase, like where the COVID-19 was spreading all over. It was uncontrollable, and we do have very limited data. Those were also a very poor data quality. We didn't have proper data for our algorithmic and all those things. Along with that, I would like to recommend something like the collaboration should be happening between the AI teams and the clinicians, and then the model transparency for the training and for vital for validations. We should improve the model effectiveness, sharing the data contract when later on WHO raised that things, the emergency data sharing contract as well. And then techniques like robustness testing, AI adaptations, data quality issues should have resolved, and like the diverse quality data collections and like domain knowledge and all those kind of things we should have take care for. recommended tools I have recommend here is IBM Watson Studio. As you can see here in the picture, how it is working, the fairness, details, and how it is supporting the accuracy of the model, and it is how it is like more into the requirement for the platform to building, like training and deploying ML models, and then how the workflows is streamlining here, how it how the user enables to manage models throughout development and deployment. So this is pretty effective and easy to use as a recommended tools, I would say. At the end of this, the summary is even though we have faced a lot of issues during COVID-19 and AI tried to help, but it was unable fully at that time because of the insufficient training data, limited understanding of the virus, because everyone were researching about the virus, what could be the proper solutions, because it was very tough at that time. Because of the rapidly evolving nature of the pandemic and spreading all over the world. So to improve it, we could include the better data collections, rigorous testings, collaboration among the experts. I mean, like in the future forward, we should prioritize robust data collection methods, fostering interdisciplinary collaboration, and all those. And so, with these steps, I think we will be having the effective of AI tools in future pandemics or similar dynamic kind of scenarios. And here are my references, and here is AI in these presentations. Thank you so much.